Hi everyone, I'm Divya S. Sharma. Welcome to our special webinar on TAVI, that is Transforming Cardiac Care, brought to you in observance of the World Heart Day. So Rahul, if you could also tell us now as to what are the kind of treatment options that are available for treatment of AS?
I think we have looked at the symptoms, look at the causes, and look at the incidence.
True.
What Dr. Jaspal has pointed out that once the symptoms start, the course is downhill, and significant number of people they die even within 2 years, more than 50%. So
Yeah.
it is very important for people to understand that symptomatic severe aortic stenosis is more dangerous than most of the common cancers, but if treated, their prognosis is extremely good. That means they again become like a normal line of living, and the chances of dying from the heart disease goes down significantly. So this is very important for all of us to understand. A dangerous disease, but treatment is very good, and the prognosis after the treatment, that the chances of survival increases significantly. Now, mild to moderate aortic stenosis, they just need regular follow up, and we give medications only to control the risk factors like their cholesterol values, their high blood pressure, and the lifestyle modifications. So mild to moderate, just regular follow up. When they become severe and they are symptomatic, they will need some kind of treatment. Now
Hmm.
this treatment will depend on the age of the patient, so whether the patient is young age or patient is of the older age. Now if the patient is less than 65 years of age, and if there is no contraindication to open heart surgery, then open heart surgery is a good treatment for patients who are relatively younger.
Okay. So
Now,
when you
if the
say young, you mean 65 and below?
65 and below, and there are certain conditions like Dr. Ashish also pointed out on the etiology, that some people they have congenital disease by birth, they have some disease, they can progress little rapidly and they can present earlier at early age, and these people should go for surgery.
Okay.
So, as you correctly, and patients who are more than 65 years of age, we
Mm-hmm.
have an option, very innovative option. Today, the point of the idea of discussion of all this webinar is about discussing about this innovative therapy, which
True.
is transcatheter aortic valve replacement. That means people know about angiography, angioplasty. We do it through the leg artery or the hand artery. Similarly, this procedure can be done in a conscious state without making the patient unconscious, without any kind of incision on the chest. You go through the leg artery, which is connected to the heart, and then you take the valve, which is folded, and then you can take it near the old valve, which is damaged, and you can place this valve, and once you place the valve, it takes over the function of the older valve in a good way. And this therapy is the most innovative, and you can say the greatest invention of this recent time. Although it came 20 years back in India, it started doing in 2016 17 onwards, when it became picked up, and so it has picked up quite significantly. So
Okay.
this is TAVI or TAVR, which is available for severe symptomatic AS patient who are more than 65 years of age. And whenever we decide the mode of treatment at any age, it is the heart team discussion where the open heart surgeon, the cardiologist, who, like we do the TAVR procedures, all of us who are on the panel, we
Yeah.
sit together, we discuss the patient's case, we discuss the patient anatomy, and whatever is best for the patient for short term as well as long term is discussed with them in detail, and then we take it forward. So age is just a little bit of criteria. There are some patients who are at very high risk of surgery, less than 65 years of age. In those scenarios also, we sometimes do a TAVR. So somebody who's 60 is not rejected for TAVR, but if he is at very high risk of surgery, we can still offer them TAVR at a younger age.
Absolutely. And it's great to hear that 60-65 is also young. Dr. Rahul, what are they commonly used, and what type of valves are there that are used in THV?
Right. So TAVR is a procedure which we are putting the valve through the groin and taking to the heart. So there are two kinds of valves which are available. One is a self-expanding. So it is trimmed inside a tube, which is, or inside the catheter, which is taken near the heart, and then you withdraw the catheter, it expands. So this is called as a self-expanding valve. Most of the valves which are available around the world and in India are self-expanding. Then there is another technology which is called as a balloon expandable valve. where the valve is crimped over the balloon. So there's a balloon and the valve is crimped, tightly crimped so that it is narrow. Then
Yeah.
through the catheter or the tube, it is put across the valve, and then you inflate, just like you inflate the balloon, you inflate this with a pump, and the valve inflates, and then you can remove the balloon and the valve starts acting immediately. So these are the two kinds of valves which are available. There are almost, including these are the two varieties, and then there are six companies which are available in our country for these valves. Now
Okay.
within each valve there are variety of sizes, and the sizes depends upon the patient's aortic annulus where the valve is fitted. So every patient will have a different size of valve, and based on the CT scan which we do of the heart, we can know what size will fit well. So this procedure is completely planned in the CT scan room. What is the size, what is the diameter, how will you go through, and all those studies are done, and then we just put the valve and come out in within an hour, as Dr. Raj Pratap Singh also discussed about it. It takes
Mhm.
less than an hour to complete this procedure, and the patient is mobile, patient is ready to go home the next day, and ready to resume his work or his or her work.
Absolutely. This sounds so exciting. I'm sure a lot of doctors probably now want to be heart surgeons after seeing the. Okay, now,
It's
so that is,
absolutely an exciting field.
yeah, absolutely. On this World Heart Day, let us pledge to take steps towards a healthier heart and a healthier world. Thank you and take care.